Hypertension, which is commonly known as high blood pressure, is a blood pressure higher than 140 over 90 millimeters of mercury. What does this mean, and how does this affect our bodies? An increased prevalence of this condition is blamed on lifestyle factors such as a physical inactivity, a salt-rich diet created by processed and fatty foods, alcohol and tobacco use. A warm welcome to the Alice Mackay Show, and today we are joined by Dr. Viveka Solanki, who is going to be a resident doctor on the Alice Mackay Show. You'll be coming on the Alice Mackay Show on a regular basis to discuss health issues. And we're also joined by Dr. Tinashe Gede, who's joining us on this particular segment to talk about hypertension. Well, hello and a warm welcome to the Alice Mackay Show. Can you just start by introducing yourselves?
Thank you, yes. I'm Dr. Solanki. I'm an emergency medical physician and an aviation medical examiner, and I work from the trauma center in Borodale.
Thank you, Alice, for having us. My name is Dr. Tinashe Gede. I'm a specialist internal medicine physician, which is sort of an adult physician, and I work jointly at the University of Zimbabwe Medical School and also in private practice.
Right, so Dr. Solanki, what is hypertension and what causes it?
Hypertension is whereby it depends on the age, of course. Now, we say in the younger age group, any blood pressure over 140 over 90, and in the more older age group, we say over 160 over 100 or so. There are a lot of causes for high blood pressure. It can be genetic, it can be cultural, it depends which country you're from. So Asians and Africans are more prone to having high blood pressure than our European counterparts. People with different lifestyles, who drink too much, who smoke too much, or maybe obese or eat too much, or eating the wrong foods, sedentary lifestyle, don't exercise. So it's quite a lot of factors about that causes high blood pressure.
Right, so you mentioned Africans and Asians being most at risk.
Yes.
Why is that?
Not most at risk, but more at risk.
More.
By and large, nobody knows, but we find that it's more common in these cultures with high blood pressure than in the others. And I think...
I think part of it is... It may have to do with the fact that genetically different races are very different, and also I think in terms of lifestyles, people's eating habits, people's exercise habits, how much they smoke are very different across different racial groups. So I think part of it is a combination of environmental and part of it is genetic as well.
Right, so it's got nothing to do with the color of their skin?
No.
Okay. All right, okay. So why has hypertension become so prevalent in Zimbabwe?
There are various factors on this. One is that I think more monitoring is taking place, so more and more people are being aware of the importance of high blood pressure. There are a lot of clinics around, and there's been lifestyle changes in Zimbabwe as well. You find that our communities are going towards what we call the fast food lifestyle, and having a sedentary lifestyle together with that increased alcohol intake, and that we are seeing a lot of complications from such a disease process in Zimbabwe.
I mean, I totally concur that I think part of it is just an increased awareness at a community level, more hospitals, more doctors, nurses, so people are being screened more often. But I think there is a very clear evolution in sort of our lifestyle habits, especially. People are more sedentary, more people drive to work as opposed to walk to work. People are living in the city, so they eat sort of more westernized type diets, and that has been known to predispose to developing hypertension over time.
So Dr. Tinashe, what are the differences between primary and secondary hypertension?
So when we look at hypertension, so the diagnosis is based on measuring a high number, and then you sort of look and say what causes it. We find that there's two big families of hypertensives. There are those where you can find a very clear cause, and we call those ones secondary hypertension, secondary to the underlying cause you'd have identified. Primary hypertension, by and large, is the most common type of hypertension. Probably 95% of people in the population will have hypertension, and that essentially means even after an exhaustive search, we can't really pin down one specific cause for it.
Right. And Dr. Solanki, why is it so important for us to monitor our high blood pressure?
The whole idea of that is basically to prevent complications of the high blood pressure, and also to monitor the effectiveness of the medication and the lifestyle changes that the doctors have prescribed to the patients.
Mm-hmm. And how often should we go for, checkups?
So I'll answer that in two separate groups. I think there's a monitoring that's for the person who's otherwise healthy but continues to carry a risk of developing hypertension as long as you're alive. And I would say for those patients, probably once every 6 months to every 12 months, at least once a year if you're an adult, you should get your blood pressure checked. And then there's a slightly different frequency for people who are known to suffer from high blood pressure. If you're known to be hypertensive, I think at the very least once every 3 months, at best at least once a month or so. If you can make an investment, I think having a machine at home where you can check your blood pressure habitually can make a difference in how good your control will be over time.
I think I'll actually, seriously think about investing in a machine so I can have my blood pressure checked often.
And the good thing is there are so many different brands. They're available in almost all of our pharmacies, and the prices are coming down. So they still cost a good amount of money, probably in the region of $70, $80. But I think it's a worthwhile investment for a disease you're going to carry for the rest of your life.
Right.
Also, I think important thing is that if you're on treatment for high blood pressure, I think it's important to measure your blood pressure more regularly,
Yes.
on a monthly basis or so that you don't let it run away from you.
Mm-hmm.
And you can advise your doctor in advance, look, my blood pressure's gone up or it's gone down, and the physician then can alter your medication accordingly.
Right, but when does it become absolutely necessary to seek medical attention?
If the blood pressure goes up too much, right? If you find it to be 180 over 100 or 220 or over 120 or so, which we find quite often, or you find that there are symptoms from there, your legs start swelling up, you start getting severe persistent headaches, if you start getting chest pains and those kind of things, I think then you need to get immediate attention.
So how high can it get up to?
Oh, I've seen blood pressures over 240 over 120.
Mm-hmm.
Yes. And you might even see worse than that.
Especially in people with severe secondary hypertension, with kidney disease, for example, it's not common to see the 250s, 260s. That's not, most of the patients we see are sort of in the 150, 160, but it can go very far high up. And I would say anytime you're hypertensive, if you feel unwell, it's probably worth getting your blood pressure checked, because hypertension can manifest with very non-specific symptoms. So it's worth getting a BP check and seeing your doctor.
Absolutely. So, but have you had a lot of patients that dying from hypertension?
Yes, we do that. I mean, you just have to read the newspapers. You find that a judge was crossing the street and he just fell down and died. Somebody was playing tennis. Yes, people playing tennis, good sports people, suddenly collapse and die. They've had a heart attack, and if you look back further, he's got a history of high blood pressure, which was not controlled very well. So it's fairly common, yes.
The problem is we don't typically code the cause of death high blood pressure, but if you look at the most sort of aggressive cause of death, sudden heart attacks, strokes, kidney disease, a substantial number of those people have underlying hypertension. So it is a very common cause of death in adult patients, including in our setting.
Yes, but is it common in children?
Very uncommon in children, actually. It's quite the opposite from the adulthood. Children are more active, even though they eat incorrectly, they're super active and things like that. And at that age group, although there are some rare cases where you find high blood pressure in teenagers, but in the younger children, quite rare, I would say.
Right, and what about the elderly?
The elderly, hypertension is extremely common. And like I said, age itself is a risk factor for it. I think the complications also you tend to accumulate risk factors for bad complications as you get older. So most people, if you look at the prevalence in 80-year-olds, it's probably close to 70-80% of them will develop at least some degree of hypertension.
Right, and on that note, we take a break. And when we return, we'll be taking a look at how hypertension can be treated. Stay with us, we'll be right back. Welcome back. Are you still watching the Alice Mackay Show? And thank you for staying with us. And I'm still talking to Dr. Vivek Solanki and Dr. Tinashe Gere. And we're still on the subject of hypertension. And in this segment, we'll be taking a look at how hypertension can be treated. What is the treatment for hypertension, Dr. Vivek?
Well, there are various aspects to treating a patient with high blood pressure. We're going to talk to them. Those with the lower sort of type of high blood pressure would say, look, let's do a lifestyle change, go on a diet, start your exercise, and monitor the blood pressure regularly. For those who are already on treatment, we say, follow your treatment through, do regular checkups, watch your diet, have your exercise regularly, drink in moderation, cut down on your smoking, or even better, stop smoking, and other factors that come into the management of this.
Yeah, and I think it's important to emphasize that a vital part of the treatment is sort of non-pharmacological, so not necessarily drugs, exercise, and sort of dietary modification. Yes. But as far as sort of pharmacologic treatment, the number of treatments we have available is ballooned out over the years. We've probably got over 100 different kinds of drugs, and different people respond differently to different medications. So between you and your doctor, they can always find a specific drug that works best for your blood pressure. The key thing is your blood pressure has to be treated to a goal. So you have to get to a point where your blood pressure numbers are acceptable to minimize the amount of damage it may cause.
And of course, before you get treatment, you need to know the signs and symptoms. What are the signs and symptoms?
Again, the signs and symptoms can vary from swelling of legs, headache, malaise. People don't feel energetic. Some people have chest pains. So it varies from person to person. There's no specific to say. A lot of people come in and say, "Oh, I got the severe headache. I think my blood pressure is up." And you find that the patient's got a sinusitis actually. So it varies.
And I would also mention that traditionally hypertension is known as the silent killer, precisely because in a substantial number of people there's actually no symptoms, so they don't feel anything. Often they turn up at a healthcare center for a totally unrelated problem and it's incidentally found that they have high blood pressure. So I'd say that there's no specific symptom. As long as you're an adult, you're at risk for it, you should be monitoring your blood pressure on a regular basis.
So when your doctor, takes or measures your high blood pressure, and let's say it's 140 over 90, what does that mean?
Well, it can mean several things. One, it could be a white coat effect, what we call a white coat effect. Because you've come to a doctor or a clinic, you may be anxious that they'll find something, your blood pressure goes up. So usually in those cases we say, relax, let's repeat the blood pressure after 10-15 minutes. And if it persistently stays high, 140 over 90, I would say it's a borderline blood pressure. We would then advocate to them lifestyle changes, diet, exercise, etc. If it goes beyond that, then of course we'd go into pharmacological treatment and what have you.
Right. And what machine do you use to diagnose high blood pressure?
So there's different kinds of machines. There are some manual machines which the healthcare provider actually inflates and measures. And then some of the machines that we now use nowadays are automated, so it gives you the number almost mechanically.
Mm-hmm. And if your blood pressure is high, what is the treatment?
Again, the treatment varies from patient to patient. It's a pharmacological treatment and non-pharmacological treatment. Pharmacological treatment is, of course, medication that we give, the drugs, and they could be a combination where we give you diuretics and other drugs with that. And the non-pharmacological ones are where we advocate diet control, regular exercise, moderation in eating and drinking and smoking, lifestyle changes.
Right.
So it's a combination of treatment. And I think there might also be some psychological aspects to that as well.
Yes.
In convincing the patients.
I think something that people bring up a lot of the times is, my blood pressure is really high because I'm stressed out. And so I think there's a lot of feeling in the public that stress itself causes high blood pressure. And to some degree, I think there may be some validity in that. So just kind of having a way to manage your lifestyle, make it less strenuous, getting good sleep habits, good dietary hygiene, regular exercise goes a long way in keeping your blood pressure under very good control.
So those are some of the distressing methods that you can employ. Okay, what about sleeping? Enough sleep?
So that's very important. And I think we've begun to realize that a lot more as people get more and more obese. There's a disease called sleep apnea, where people just don't breathe well, they snore a lot at night, and they don't get rested. And it turns out that sleep apnea is a very strong risk factor for hypertension.
That's true.
The body has a way to regenerate while you're sort of asleep. So people who don't have very good sleep hygiene and live sort of a type A high stress lifestyle are more likely to become hypertensive over time.
But how long should we sleep for?
Depends on age. So babies sleep a lot more, probably first few weeks, probably most of the time 18 hours. But I think for the average adult, at least 7 hours of continuous uninterrupted sleep is very important for your body's capacity to regenerate.
Right.
Also, a lot of people, they think they're sleeping through. They say, we're getting about 6 to 8 hours sleep at night. But again, what we're talking about is sleep apnea, where they keep getting woken up and they're not realizing that. They can't breathe properly and they wake up, so the body doesn't shut down correctly, and it takes some time to fall asleep again, and they wake up tired. And there's chronic tiredness as well that comes into it.
Right. Right. So if your high blood pressure is left untreated, what is the worst case scenario, or perhaps the cost implication that one may face?
So I guess the most extreme is, in a lot of people, it's a cause of sudden death, either because you develop a major stroke, you develop a severe heart attack, your kidneys shut down. For those who, are in some ways lucky not to die from it but still don't get treated, there's a risk of complications spanning the gamut of disabling strokes, incapacitating heart attacks, really bad kidney disease, blindness. So it can affect any part of your body over time if it's left untreated.
Yeah.
From a cost perspective.
Needing dialysis,
yes,
kidney transplants, things like that, it can be very, very expensive.
Yes,
of course, you may not be able to work as well, unable to go to work because you're too ill. So the cost implications are substantial.
Mm-hmm.
both directly from needing to treat complications and also indirectly from sort of time lost from work and productivity.
Dr. Solanki, we know that people are really big on herbs. What are the other alternatives, in terms of treatment?
There are quite a few that people use these days, from meditation to yoga, herbal teas, herbs. And I say that with caution. I say if you've got bad high blood pressure, continue taking your treatment and use this as adjuvant therapy. I think yoga, meditation, all these things do help us.
And I think with alternative therapies especially, there's different kinds and they're practiced differently in different parts of the world. Some of them have been validated, like yoga, meditation type exercises definitely makes a difference. When it sort of, spans on to herbal treatments and Chinese type treatments and stuff, we don't have enough knowledge about how effective they are. So I wouldn't stop my treatment only because I was going on something herbal. As long as you're taking your treatment, I think as adjuvant therapy, they're probably not harmful and may be beneficial.
And on that note, we take a break. And when we return, we'll be taking a look at the dangers of hypertension in pregnant women. Stay with us. We'll be right back. Welcome back. Are you still watching the Alice Mackay Show? We're now in the third segment, and I'm still talking to Dr. Viveka Solanki and Dr. Tinashe Gere about hypertension. And in this segment, we're going to be taking a look at the dangers of hypertension in pregnant women. Well, welcome back.
Thank you.
Thank you, Alice.
Why is hypertension such a major concern in pregnant women?
Very important question there. The concern is because of the high mortality rate. It causes a lot of deaths and complications in pregnant women, basically because they were undiagnosed, they were not picked up early enough, and it causes severe damage to the unborn fetus and the mother, and both could die if they are not treated adequately and in time.
When you look at our own local statistics, probably 1 in 3 women who die with pregnancy die from a problem related to hypertension in pregnancy, so it's a very substantial cause of maternal mortality.
Yes.
Right. So what is the impact on the unborn child?
So what happens with hypertension in pregnancy is essentially at the most extreme it can lead to either the death of the mother. It's not uncommon for the baby to die in utero or sort of shortly after delivery. It's a very common cause of what we call intrauterine growth restriction, which basically means the baby doesn't mature or grow adequately during the time they're pregnant, they're carried in the uterus. And so babies who are born with intrauterine growth restriction are at high risk later on in life of developing heart disease, hypertension themselves, and sort of coronary artery disease or heart attacks. In the short term, many of those babies are forced to be delivered prematurely because the blood pressure is uncontrollable, and so they're born preterm with attendant complications and sort of potential for disability.
So what precautions should pregnant women take during and after birth?
Well, the important thing is if you're planning to have a baby, and most people do plan to have a baby, have a full medical checkup and things like that.
Yeah.
And there are those few that don't plan to have a baby, and so should go for a checkup as soon as they find out that they are pregnant and have it monitored. And especially if there's a history in the family where the mother previously was having high blood pressure in pregnancy, or the mother has a history of her parents having high blood pressure and things like that. Yes.
Right. I think it's also important to mention that especially first-time pregnancies, young girls or people having their first pregnancy, the risk of hypertension seems to be high in those first pregnancies. And also women who are slightly older, sort of mid-30s, late pregnancies, they are also higher risk for having hypertension, so they should be vigilant with getting their blood pressure checked.
Right. And what are some of the diseases that are associated with hypertension?
Well, again, in the pregnant women, the disease process is similar to those non-pregnant. Cardiac problems, cardiac failure, the renal damage, stroke risk, and also the protein levels go up in the urine, and that shows that the kidneys have been severely damaged.
Right. And what are the differences between high blood pressure and low blood pressure? Because I've heard about low blood pressure.
So I guess from a technical term, we call high blood pressure hypertension, and we call low blood pressure hypotension. Both of them can be very devastating. And the way to think about it is you need a certain kind of pressure to drive blood to supply your organs. If your blood pressure becomes too low, you don't get enough perfusion to your brain, to your essential organs. It's not uncommon to feel faint. You can develop complications the same like kidney disease because of poor renal perfusion. And so both hypo and hypertension are serious medical problems and require urgent attention.
In fact, you find this, hypertensive patients, they come in, they say, oh, they're feeling dizzy, they feel malaise, they don't have energy, and usually they think, oh, we think our sugar level is low. It's actually the blood pressure that's quite low. And it's quite common, and most people don't pick it up, or they're not aware of that as patients until they go to the doctor and explain that the blood pressure is measured, and they find it's quite low.
Mm-hmm. Right, but which one would you say is more dangerous?
Of course, hypertension is more dangerous because of the risk of having a heart attack and a stroke and things like that. But having said that, hypertension, you're driving a car, your blood pressure drops, you faint, you have a car accident, you die. Well, so you've got to balance it out.
There's a way to
But
think
they're both
about
more
it.
just as dangerous as each other.
And I think part of it is people generally don't tolerate low blood pressures very well. So most people who are hypertensive figure it out very quickly because they don't feel very good. On the other hand, hypertension can be totally asymptomatic, and you will not know about it until it causes substantial damage over time.
Okay, so in Zimbabwe, which one is more prevalent? Do we have more people with high blood pressure or low blood pressure?
Hypertension by far. There's
far.
a lot more hypertension.
Okay, all right. And what is low blood pressure associated with?
So probably the commonest cause of it is actually treatment for hypertension. So people will take blood pressure medications, but the dose is a little bit too high. And then there are things that can transiently drop your blood pressure. If you develop a diarrheal illness, you're nauseated, you're vomiting, you're not drinking, so your blood volume goes down. People who've had major bleeding, so pregnant women who are delivering, they have major bleeding.
People who also heavy menstruations and things like that, their pressures drop.
Okay.
And also important point here is, yes, the people with high blood pressure who've been over-treated. And you find that people have been treated, patients come to us and say, yes, we've been on treatment for 10 or 15 years, the dosage hasn't changed, they've been getting older, and as we have previously said, the older you get, your blood pressure, usually we allow you to be higher, and you find that you have to adjust the blood pressures. And you find hypotension is more common or prevalent in the older elderly patients.
Right, and are kids likely to be hypotensive?
Difficult to say about hypotension in children. Again, I mean, they drink adequately, they eat, they're active and things like that. We don't really find hypotensive children.
So how can hypertension be prevented?
So there are things you can do that actually make a difference into both your risk of developing hypertension and your ability to control it. Part of it is recognizing that some of the risk factors are things that are lifestyle related. So watching how much salt you take, the recommended dose is not more than 2 grams in 24 hours if you're hypertensive. So like a teaspoon that's flat per day. Watching how much alcohol you take, so moderation is very important. And then sort of, if you can, quitting smoking or at least cutting down how much smoking you do. And probably the most important is regular exercise. People who are very active, who maintain a very good weight, are less likely to become hypertensive over time.
Right, and which exercise would you say is the most effective?
People you don't have to go to the gym. Brisk walking, swimming for those who have a swimming pool, those who can go and walk around the block where they live, passive exercise like that, half an hour per day, enough to break a sweat, and that's adequate. But more important also with this exercise is control of the food. Have a balanced diet. We don't want to have these full plates of salsa and a lot of bread in the diet and things like that. Balanced diet, of the right protein amount, the right carbs, lots of vegetables, lots of salads.
Right, and your last comment, Dr. Zlanki?
My last comment is regular exercise, regular checkups, and moderation. That's what I advocate.
Yeah. So it's moderation, moderation, and moderation. So whether you're going to go out drinking, eating, smoking, or whatever it is that you're doing or do, please just moderate it and don't do it excessively, because that can actually endanger your health. And on that note, we've come to the end of the Alice Mackay Show. Thank you for tuning in. And we'll be having Dr. Viveka Solanki on a regular basis to take a look at various health issues. Goodbye and see you next week.